What if breathing can affect your life in ways you never imagined? And what if breathing testing can create tremendous financial opportunities for your practice, where you can have both clinical benefits for your patients and at the same time, significant financial benefits for your practice. So this and a lot more we're going to discuss today in Your Practice, Your Money, where clinical success meets financial freedom. See you in a moment. Welcome back to Your Practice, Your Money, where clinical success meets financial freedom. I'm your host, Dr. Dimitrios Kostopoulos, and today we are going to dive into what? Let me take a breath. Breathing science. Ooh, but measurable physiology powered by computer-based science. And I have with me a very good friend, and I would say a business partner to some regard, Denise Campbell, who is an amazing individual, but so a very business savvy person. Denise is the owner of multiple businesses. She owns the Southwest Pine Center in three different locations, I believe. She's part of Physical. Her locations are in Las Cruces, in two locations, and then in El Paso also. She is also the owner of Real View Diagnostics, which is diagnostic testing business working with hands-on diagnostic. She also has OcuSport and Optimum Body Shop. And today we're going to be speaking about Breathing Science Institute. Denise, I'm just impressed with just the way presenting you and all the stuff you're going to talk about. Hey, welcome to the podcast.
Thank you, Demi. I'm glad to be here. Excited to talk about this with my other fellow practice owners.
Awesome.
Yeah.
So tell us a little bit about breathing. What is this about? And how did you come up with the idea of even being involved in this?
Well, it was kind of a chance discovery. Actually, 22, going on 23 years ago, I had a physical therapist that got hurt in my practice. I'm a spine and orthopedic specialist and was working with her, and I couldn't seem to get her better. I knew she had an SI joint problem. So I went to actually see Diane Lee in Vancouver, and we were in a course. And from the front, she said, "Oh no, you're not going to be able to help her till you fix this over breathing." And I'm like, "Over what?" Right? I'm like completely lost, feeling totally ignorant. This person sitting beside me, I'd treated them for 8 months, and this therapist tells me something I've never even heard of. And anyway, that started it. They said, call this guy and get her on a capnometer and correct her breathing patterns and her dysfunctional breathing, and then probably whatever you're doing will work. And she was correct, right? And so that started the saga. So I've been using my practice as a test kitchen, so to speak, for the last 20 plus years, and going into the use of capnometry. Capnometers measure real-time carbon dioxide levels. When you go into surgery, that's what you put on, right? At a big level. But we had a small one that you could use to a computer, and then we've been working over these years to make it applicable and easy to use in outpatient physical therapy.
Give us an idea. How can this be applicable within the physical therapy profession? Why is this applicable within the PT profession? And in what type of conditions can it be used? Right.
I asked that same question because I'm seeing that once I understood the effects, because low CO2, which we're measuring, drops blood supply to the brain, okay, up to 60%. It creates all kinds of different symptoms that masquerade as musculoskeletal symptoms. So we're not able to actually figure out which one is which without something like this. And so I did a study where we did a baseline measurement. This is the little capnometer now of 100 consecutive patients. We're just an outpatient orthopedic practice type, a little bit of other things. And we found that 66% of our patients were hypocapnic coming into the clinic. And the ones that were severe, had severe pain, we used photo. We looked at that, were chronic, they had fear. They were 100% severely hypocapnic. So they're coming in with these different symptoms that affect the whole different, let's say like headaches, severe neck pain, especially anything from the chest up, right, was a big factor in dealing with that. But any condition, chronic pain especially. So that made me think, okay, there's quite a bit of people here that I'm missing something to get them better. And we all know how chronic pain has happened.
Yeah.
This is what hypocapnia does here. Just very quickly, again, low CO2. And so if you look at a brain here, then this is what happens when we breathe normally. And this is what happens when we overbreathe or hyperventilate. See, the blood supply and the oxygen levels drop dramatically, and that causes most of what we know as our stress symptoms. And if you keep going, it will lead all the way to passing out, right? So these are the types of patients that benefit from this. This is called a Capnogo instead of just a capnometer because we made it where it's portable. It's Bluetooth, a long-lasting battery, and so you can use it around in the clinic. You can put it on someone, then go for a bike ride. So if you notice, these are all the things everyone's probably seeing in their practice. Would you agree with that, Demi? Just
Yeah,
the
pretty
basic
much.
things we all see, right?
Absolutely.
And then there's other things like this that can be new market types, right? So we work with athletic performance, of course, stress management. These can be included in your physical therapy, or they can be separated out as cash services or open up to other avenues. Asthma, for instance, is not something we usually see, but research shows us that 34 to 38% of all asthma has no asthma markers. And that's because it's due to hypocapnia. So
Hmm.
the constriction that you get in your brain to the blood supply is also in your bronchial tubes. So you get constriction because it's trying to hold it. It's trying to hold your CO2 in there that you're blowing off too much,
Oh.
and it's causing asthma.
And it's
Yeah.
interesting. I see also memory there, and
Yes.
memory, especially with the rise of Alzheimer's and all the science around Alzheimer's. It's a hot topic nowadays. People take lots of supplements to increase blood supply in the brain and oxygenation for memory and sharpening of decision making process and all that. It's interesting that
Absolutely.
you are listing that as one of the benefits.
Yeah, because if you don't have blood supply, right, nothing happens. Things don't heal. One that's not on here that's probably back on the other one is concussion, right? Recovering from concussion as well. So increasing blood supply and keeping it at normal levels in your brain is very, very important in anything you're doing. And basically, we kind of walk around as a lower version of ourselves because we're not fully capacitated, in where we should be most of the time. And we've learned to adapt. I think anybody thinking about the patients that you currently have, it's another group that you can start to develop programs around. You don't have to do anything really, but learn how to use it and how it affects them and do some differential diagnosis. We have some patients that we look and see if their breathing problem is their greatest barrier to their recovery, or if it's just a small part, just a reaction. So some people are chronic, long-standing, especially chronic pain. When the lion jumps in the room, so to speak, and it doesn't jump out, how do you deal with that over time? And one of the ways you do that is you lower your CO2 levels so you actually disassociate from yourself and your pain. This is what women do when they have babies. But what happens is, as a coping strategy, you get stuck in it, right? But unfortunately, not only you're disassociating from your pain, you're disassociating from your loved ones, from your work, from whatever you're trying to do, right? It's kind of a all or nothing, all or none, right? You can't just turn it on and off, and then they get stuck there. And even when they want to come out, they can't. And it also, when you lower your CO2, it increases the irritability in the nerve. It makes it fire more quickly. It lowers that threshold. There's all kinds of neuro cascade that happens. And it's warnings, just like pain is always a warning sign, right? These symptoms of stress that we get, our heart beats a little faster, we're not as focused. You get up to do a presentation or you go to take a test and you know the material, but you can't recall it. Why is that happening, right? So it's very important to get them in a state that's normal. This is just another vital sign, right? You wouldn't want to work with someone who has low insulin levels, right? They're
Yeah, of course.
hypoglycemic. They're not functioning as well. Their blood pressure is too high or too low, right? You need to get them in the right state to do what we need to do, the rest of them. This is just another way. And we had not, even though the science is old, the technology wasn't there to make it to where it's usable in practice.
All the stuff we're talking about, those are symptoms that take place through the physiological process of hyperventilation. It's hyperventilation that is causing this.
You can also be hypo. Like, for instance, I'm a breath holder. I respond to stress by holding my breath. I don't want to
I see.
overreact, right?
I
So
see.
I'll hold my breath. And
So
I
it
don't
can
even
be
know,
either
depending
way,
on the
hyper or hyper.
situation. Yeah. And that's why, we've all been taught breathing mechanics as PTs. Well, the breathing mechanics for you what I say is normal, right, may make you hypocapnic, and it may make me some breathe better. And the only way because it's about chemistry more than mechanics. See, that we've always had the mechanics, but we hadn't had the chemistry
Mm.
to see if what we're doing is actually what we think we're doing. So the lady I was telling you about when I first did it, she was breathing at 28 to 32 breaths per minute next to me, and I had no idea. Normal's, 12 to 14, maybe 16. And a lot of people say get down to 8, okay, 6 to 8 breaths per minute, meditation, you're getting in this. Well, if I did that to her, she would just completely fall apart. There's
Yeah.
no way, right? But she has learned actually to keep her chemistry and her levels up at breathing at now around 18 to 20. She found her sweet spot and she can shift into that. And then what's really interesting is once you know your symptoms, you can move yourself in and out of different levels because it's behavior. See, we've taken over. This is behavioral hypocapnia.
Hmm.
It's not because we want to do that. That's what happens in hyperventilation. You hyperventilate, you end up passing out. Your body goes back to your breathing reflex in your brainstem, and you start breathing like a baby. You
Yeah.
breathe perfectly, right? When I realized my own hypocapnia and issues were caused by my own behavior, I got kind of upset, because I was 42 years old. And I'm like, really? I've been doing this to myself the whole time. And so now I've used this as a feedback tool and understand it, and I can make my levels move in and out of an area. So like if I'm trying to get ready for a podcast and I've had a lot of other things going on, how do I get myself into a good performance? So what happens, you overbreathe for whatever reason, whether it's most of the time it's breathing too much or shallow, like up in your chest. We get out of our diaphragm, right? And we're up here in the chest and we start breathing up here. We kind of call it north-south breathing versus east-west breathing. And you're just using the top of your lungs. That leads to low CO2, which is hypocapnia. That starts to decrease and change your pH, causing vasoconstriction. Then that decreases your oxygen levels, glucose, blood supply to the brain, as well as to other organs. I treat people with glaucoma because the blood supply to the eyes is the same as the blood supply to the brain. It also affects your placenta. it has a lot of different areas, right? Looking at cerebral blood flow and cerebral blood volume. So the baseline is up here. Here's someone that has too much CO2, which sometimes they do in medicine for different problems. They also have people overbreathe on purpose, like I'm an athletic trainer. You go in the field, someone has a neck injury or a head injury. We want to constrict the blood supply. We do not want more bleeding at that point. So you'll actually take them down for that. But you can see here in the blood flow, the difference in the pictures, it's pretty dramatic, right? And we know that anytime the brain doesn't have what it needs, it's going to get it, right? One way or the other, just part of our survival. This is
Computer
the
screen.
Capnogo, all right?
Okay.
Small little piece. You have things that you have on it. And then I have on my body is I have a Holter monitor belt
Okay.
to check my heart rate.
So it's going to measure at the same time heart rate and respiratory rate.
So I'm going to put on the cannula. So this goes just behind your ears like this, in the nose. And you'll still see me start to breathe here. See that? So this line right here is 35. That's normal carbon dioxide levels. You'll start to see a running total up here at the top. All right. And I'm talking right now, so it's a little bit low. But when I stop here in a minute, and I'll give you an example of some box breathing, this bottom just starts to tell us how many breaths we're taking per minute. A little index, green is good, red is not so good. And this is kind of where our median levels. So the whole idea is to get this level up. I just took a deep breath. What's happening is I can't extend my exhale. So you can imagine if I'm not breathing too good and I really start to talk, I'm sure there's people out there that get breathless and start to not feel good when they do a lot of talking, right? Well, if you're already low, then how is that going to be? The other thing that it measures is heart rate variability. So heart rate variability is a really big thing. So even though I'm talking, I'm pretty calm. So right here, this is a spectral analysis of the different frequencies of your heart rate variability. So what you want in heart rate variability is you want flexibility of the heart. I need to be able to lay down, take a nap, or I can jump up and run out of the room because there's a fire, and I have to be able to do that. So this right here is the red is your sympathetics, the green is your parasympathetics, and the blue is your middle frequencies. So when you're sitting here looking at someone, you're really looking at a lot of different aspects of that person. It's almost like a little tunnel into their soul. You can really see what's going on kind of behind what we try to hide, right? So as you see here now, this is turning a little bit more sympathetic, and sympathetics aren't bad, right? At all. You just need the whole thing of the flexibility. So one of the things I learned when I was working on my master's in the breathing science was that it was the most significant thing that's really impacted me. So it's a take-home message, right? It's not that your sympathetics are turned on, it's your parasympathetics are turned off, right? And so
that double negative, the parasympathetic function, and that being turned off also, right?
Right. So it's like the brake's not going. Okay. The brake's not going. It's just on.
What you show us, does it produce some report, something where you can give to the patient or discuss with the patient?
Yes, absolutely. So all this recording goes to the cloud. You can have the different patients, different levels. You see how I was able to stop talking while you were talking and kind of going back to some different breathing?
Yes.
You see how I built these two parasympathetic peaks?
Yeah,
and
huge
my
difference
sympathetics
there.
started going down.
Wow.
And you see now, and so this is real time live. And what we really want people to do is to be able to build 4 peaks, right? And get that because your vagal nerve, right, is going down to all your internal organs as part of your parasympathetics. All those things need to get turned back on. That's rest, recover, restore, all those functions versus go, go, go. Lowers your heart rate, does all those things.
It's
So
trying to build there. I see it trying to build. The fourth one
yeah,
is
because you
trying to
see here,
build.
I'm like talking. It's like, okay, she's got to get this out there, you know. So it's
Yeah.
my system is supporting me as it should be. But you can imagine, I have patients come in. This is flatlined. Okay, you don't see any blue, you don't see any green. It's just red, and they're just stuck there. So there's actually a resonant frequency that goes between your breathing and your heart rate variability that actually is the motor to restore and recover your immune system. This is how our body works. This is the physiology, right? When we get stuck in that.
I'm wondering what would happen when somebody is watching the news and
Exactly. The other thing that I haven't mentioned is this also has EMG. I don't have that on, but you can do surface EMG.
surface.
So you can actually see the tension or the different things. I had a tennis player once that thought his calves were cramping. And so he had quit playing for a year. And so I was able to put it on his calves, show him what a contraction looked like. And then when he actually came on with what he thought was cramping, which was really low CO2, then he was able to see, oh, it's really not that very quickly. And within 1.5 sessions, the guy was recovered and back, went to number
Oh,
3 in the
wow.
state. So people are smart. Our physiology is super adaptive. And so when you're able to show people and give them some education, they can see that to change.
Yeah, I can see that.
Your question was, how do you capture this? So you can print
Correct.
this out, you can stop this, take a picture, put it in your chart. You can have them in the cloud. You can watch people when they do their own program, their practices. We have practicums built into this so that you can work it on yourself, or you can be led by a practitioner in your clinic. Here is kind of your revenue generation, right? Getting down to your practice, your money. I'm on my heart's for patients, right? And when a patient's in front of me and I really can't give them what they need, then I've always figured I need to go find something, right? I need to figure this out. And when knowledge comes your way, you need to use it. Now you're responsible for doing that. So these are the different ways we build insurances. This is the cash model, and these are the different practitioners. Anyone can do it, a lot of different people. I treat people with it all over the world. As long as you have a capnometer, you can do it over the screen just like we're doing. When you look at the practitioners over here, the PTs and PTAs are really the best equipped for this with our background. And one of the main founders of working with capnometry, Dr. Peter Litchfield, he agrees with this. And you just need some basic education on utilizing it. You can go in and help them, or they can also use it themselves because there's practicums built into the software. So you could actually set it up in your office if you while you're getting this going, and people can come in and practice themselves, or they can rent them, take them out. You can treat them online while they rent them. They can bring them back into your practice, or you just use it inside your practice on a visit.
What do you charge for this, the patients?
If you're using it in physical therapy, these are some of the insurance codes that we use.
I see. Physical
So
performance 97550, something like that, right?
yeah, 3, 5 maybe, but yeah,
Yeah.
so if we do an evaluation for 45 minutes, we'll build 3 units of physical performance test. It has the computerized printout. It meets all the requirements. Neuro re-ed is another big one because you're kind of re-educating their entire system on homeostasis and how that works. Cognitive behavioral therapy, we're still working on, sometimes they pay this, some don't, but I've spent a lot of time trying to get this on for physical therapists because we do it anyway. We're just not calling it that. Therapeutic activity, you can also do it in a group. If you were going to do a cash service, you would just come up with however much you wanted to do per session. If people wanted to rent it, they can rent it outside of that, take it home. You can call them. This is like remote therapeutic monitoring. I'm hoping that it's going to go into physiological monitoring, but we need to get physical therapists to where they can do that, right? Because right now we're not allowed to build that. So if you go back to that other slide that we were talking about, these are a lot of your cash services of things you can build that add to your practice, right? Long COVID, high performance, stress, anxiety. The whole world is anxious, right? Calling for us right now. Or you can be back in your regular practice with these TMD and headache is huge. We've been using this for a long time, and especially because you can put the EMG on their jaw and you can see it relax or change, which we've been using biofeedback in this for a very long time in our practice.
Very, very interesting. So this can be a definite adjunct to your PT treatment, but also you can do promotion to this and get you clients also in your practice, all of these type of symptoms.
And you'll set your practice apart because very few people yet know about it. That's one of my jobs I feel called to, that I need to get this out to physical therapists so that they can realize this in front of them and help them. It's huge in pelvic disorders and pregnancy. I mean, each one of these things could be its own entity, right? Like I'm a spine specialist, right? So I do differential diagnosis of numbness in the hands and feet compared to polyneuropathies and radiculopathies because overbreathing causes that. So if I can make their symptoms come and go by their CO2 levels, then I know that it's not that. So I worked with a surgeon for many years. He would send them, all his patients, to me to make sure that they were good candidates. Because we always know there's a psychological kind of factor. There's some kind of weird factor, right, that makes some patients not recover. And this is part of that. And whether or not you find out whether that is, but anyone that has to have a neck surgery or back surgery, that's traumatizing. That's scary stuff, right?
Absolutely.
And so how you're responding that can affect your recovery. You can just go on and on in each one of these things, but it is a wide open, untapped, and much needed treatment that physical therapists can incorporate into their practice pretty easily.
In our podcast, we talk a lot about objective testing and diagnostic testing like EMG and ultrasound and all that. And those of you who are already doing EMG and ultrasound testing in your office, this type of breathing tool and equipment does fit in that alley of objective diagnostic testing where you measure something, you do an intervention, you do a training, and then you are able to remeasure and see actual result.
We've used it in our practice, Demi, like that, because one of our therapists is very much knowledgeable of this. So sometimes, as you've experienced, people are too irritable to make it through the EMG, or they're suffering a lot, or they put it off, right? So we had a guy come in and he was run over by a tractor and then backed back over, right? His nervous system is a wreck. Well, they couldn't do the testing. He just couldn't stand it because it makes, remember I was telling you about your nerves are more irritable. It's like putting your pain through a megaphone. And so we were able to do just a not very long intervention, calm him down so he could get through the test, show him how to tap into his own medicine cabinet for calming, and then refer him to the PT practice to help him with pain control. So that's just an example of how you can use it.
Awesome.
It's been a great journey, and it's just exciting to help people because when you change someone's breath, it's kind of like your college or our physical therapy. No one can take that from us, right? And we take it in whatever domain we're going into. Well, now when you can really understand how your breathing impacts your life and it's your behavior, you can take it into your relationships, to your testing, to your profession, to speaking. It goes anywhere with you. So it's never a bad thing.
Awesome. Well, Denise, I want to thank you very much for a masterclass in breathing science, okay? From
You're welcome.
technology to protocols to practice growth. That was amazing. So thank you so very much for joining us today.
Thank you, Demi, for having me.
If you enjoyed this episode of Your Practice, Your Money, please follow us and subscribe on Spotify, Apple Podcast, on YouTube, or wherever you listen. And also rate us, because rating the show or leaving a review, it helps more physical therapists to find us. Share this episode with a colleague who is ready to move beyond just taking a deep breath into measurable change, into change for their practice. So see you next week. Until then, keep building clinical success and financial freedom. Take care.